So Don, I'm curious, what is the difference between physio and a chiropractor?
That can be a difficult question. If you get a straight chiro, you can get some chiropractors that all they do is adjust people. And so we call them, in the profession, they get called straighters. Sometimes they get called philosophical-based chiropractors. And all they use is manipulation. Then you get some physios that all they use is EPT, electronic machines, ultrasound, TENS machines, interferential machines, things like that. You get some physios that will do cardiac rehab or slow exercises with geriatric people. And so there's people on the fringes all over the place. And I think at the baseline level, generally speaking, I'd say chiropractors are better with spines, physios are better with muscles. When you get to the more advanced level where you have people who focus in rehabilitation as a specialisation, the lines become extremely blurred. So at our clinic, the first thing that we do is a very comprehensive assessment. And we would say, from our feedback from other practitioners and practitioners that come to us for treatment and for questions regarding their patients, we have one of the most comprehensive new patient assessment protocols in the country. So we thoroughly analyse someone to work out what's going on, what do we need to do to get them where they want to be, and then we will do the rest of our orthopaedic and neurological tests to work out exactly what is the diagnosis, what do we need to do to get a result, what exercise do we need, what treatment modalities do we need to use. Do we use soft tissue work? Do we use manipulation? Do we use shockwave? Do we use exercises? Do we use home strategies to address ergonomics, sleeping postures, things like that? So it's a very comprehensive assessment. And I think at that top level, I know some physios who I think are brilliant as well that do very comprehensive assessments like that. So the boundaries can become very blurred. Some physios will use manipulation as a tool. And at one point in the early 2000s, manipulation was actually the most popular postgraduate qualification for physios. Now I think the most popular is probably dry needling. You see a lot of physios doing dry needling. At the same time, lots of chiros do. Iris has done dry needling. Mahalia is currently doing dry needling on our remedial team. I'm doing dry needling. We have an acupuncturist that does acupuncture, and contrary to some people's popular belief, acupuncture and dry needling are quite different from how they do their needling and how they approach patients. So I think it's a blurred boundary, and what we do with our team at the clinic, it really makes it much harder for people to define the difference. And so often people come in, and I've had some patients who've been my patient for years and have never realised that I was actually a chiropractor until we talk about it one day and they're talking to someone on the phone. When they come in, they say, I'm at the physio now. And then when they get off the phone, I say, you realise I'm not a physio, I'm a chiro. And it's a shock to them because they never realised, because they'd never asked me about what my actual profession is. And because I often say to people, I'm a chiropractor and an exercise physiologist, but what I really do is focus on rehab. And so that's a hard question to answer, and I hope I've done it justice.